Okay, my name's France. I'm gonna be your nurse today. Make sure you emphasize closing the door. So I'm gonna be getting your vital signs today, doing a quick head to toe on you, which should take about 5 minutes, 10 minutes, blah, blah, blah. Okay, I'm gonna take this, take a wipe, gonna clean here. How you doing today? Okay. All right, could you verify your name and birth date for me? Yes. Okay, beautiful. So will you let me know if you have any allergies? Okay. You know, doing all the vital signs. So are you feeling any pain right now? Mm-mm. If they say yes, obviously, there's all that crap. Okay. Just let me take a look at you really quick. Okay, you're looking relaxed. You're gonna look right at your face, straight at it. Looking symmetrical. Okay. All right, appropriate clear. I don't really know what to do for your speech part there. That's more of a charting thing. And the hearing. Anyway. What? This is more like documentation, isn't it? Anyway, skin stuff. Oh, the stars are the assessment. Sorry, Danielle. Okay. So what you're gonna do is you're gonna be like, I'm gonna look here, just looking at your skin here. So like lift it up, and you're seeing the color. Touch it with like the back of your palms to get the temperature. And then like what I like to do for these assessments is I like to say like, oh, okay, like I'm feeling all right. You're warm, you're dry. Obviously the baseline, what you want. Okay, you're dry, you're warm. Don't say color appropriate for race because that's weird. Okay, like your skin looks like it's intact. I'm gonna give you a little pinch right here, okay? Looking for your here. All right, goes right back to how it was. And then I'm looking at the heels. You pick up the heels and you like look at the bottom of it. Like completely look at the bottom of it like that. Or like if it's like an older patient, like rolling. So like technically you just have to like lift his leg up. And then yeah, same thing here, like looking at coccyx last hip area. Okay, to assess. So I'd be like for A&O as in alert and oriented. So you're gonna say, they already said their name. And be like, do you know where you are right now? And be like, okay, do you know what year it is? Or some question like that. Another question too is like, oh, do you know who the president of the United States is? Touchy subject. Okay. And then so hand grasp bilaterally, you're even like grab their hand and be like, give me a squeeze, like that. And then motor response in upper and lower extremities. So also for this here, so for upper and lower, what you're gonna do is for the upper, take your arms like this, you're gonna say, okay, now push against me, and then grab their hands. I don't know if you have to do this exactly. Oh wait. Oh yeah, here we go. So like push it. Well, this is how we did it at our school. We would say, take your hands, say push against me. Now pull. Now you take the foot, say like, okay, step on my foot like you're stepping on a brake. Then you feel the pressure. And you'd be like, don't let me, or then now like push against it. You know what I mean? So like pushing like this, step on the brake, holding right here. If that's unclear, just text me. Next is, yeah, respiratory system. So inspection. A big thing I know with like respiratory system, it's important if they're like sitting or laying down, make sure you're looking at the front. This is just nitpicky, but we also like look at the side, making sure that the chest is rising and falling at like in a normal way. Do you know all the spots to listen to someone? I'm guessing your textbook says it. I'm gonna take this off. I'm guessing your textbook says it. But if not, tell me, and then I can show you all of like the anterior, posterior spots to be listening. Cough or speed, and make sure you ask too, like, have you been coughing lately? Like, or when, like, have you had a cough, blah, 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 something like that. And then make sure you're inspecting it too, stuff about that. Like, I'd be like, oh, have you had a cough lately? If my patient is like, yeah, like, I have started coughing like occasionally. I'd be like, okay, like, is it productive? Have you been coughing anything up? And then ask like the color, like, would you say it's thick? Would you say it's thin? And obviously if it smells and if it's been a lot. You know all the spots to listen to the heart? The aortic, the pulmonic, Erb's point, tricuspid, mitral. Let me know if you don't know that one, but that's like on a diagram, just copy it. Capillary refill, you know, like, okay, I'm gonna check this now. I'm gonna give you a squeeze here, give you a squeeze here, and then assessing peripheral pulses. Gonna come down here, oh, here, here, calf tenderness, and then, oh yeah, for peripheral edema, do you know how to do this? You just like take that here. I don't know if you can see, sorry Daniel. You like press and see how it comes back, see what that looks like. Usually, like, again, I really exaggerate. I'll be like, okay, no edema. And then abdomen, listening to all four. Here, like, have you had any nausea or vomiting? No, that's good. Make sure you're like emphasizing each quadrant. Nutritional status, you don't have to say this, there's no start by it, but I would be like, have you been eating well? Something like that. When was the last time you had a poop? I would ask that. Like, have you been going regularly? Like, do you normally do every other day? Like, just like kind of dumb questions like that, just to get an idea. Oh, sorry, I skipped ahead to the abdomen.